Members of the Public Accounts Committee have expressed concern over the absence of specialist mental health institutions in the northern parts of the country. This concern arose during a committee sitting where it was revealed that a mental patient from Savalogu in the northern region had to be transported to the Pantang Hospital in Accra for care.
The committee's scrutiny of the 2022 Auditor General's report on Tuesday, January 30, began with frustration due to the absence of the health minister and both deputies.
Chairman, thank you. Chairman, I'm not convinced with the reasons why the ministers, the two deputy ministers, and also the minister is not here. We have colleagues who have contested this election, and they are here. If they have lost, there are people who have lost, and they are here. Two of the deputies lost, that's fine. But it doesn't mean that they shouldn't work. Are they resigning? And if they're not resigning, they should be here. So I don't think that that's a good excuse. Because they have gone to contest elections, they are unable to come.
However, as tempers calmed, committee members delved into various issues, including the litany of unserviced bonds and undeserved salaries reported in several health facilities nationwide.
When they go, after we have trained them, and they go, that is why this committee in the past recommended that guarantors alone or the guarantor system is actually not effective. We recommended a bank guarantee that before you are granted this, you should go for a bank guarantee. A bank should guarantee for you that you will come back. And before the bank will give you this guarantee, they will be sure that you will come back. And for the human being, they'll be there, but you can't take that person if there's a default. But the bank will refund the money to the institution if they fail to come. So the bank will make sure they put a lot of things in place.
However, the Director General of the Ghana Health Service, Dr. Patrick Kumabwaji, believes the bank guarantee system will be difficult to implement.
I think that will be difficult because we also need certain capacities. It is also in our interest to train some people to come and offer some service. So putting such major obstacle may be a problem because majority, more than 95+% return. And so we may have to relook at that bank guarantee directive. Thank you.
Specifically discussing the Pantang Hospital, it emerged that a patient had to be transported from Savalogu for treatment, prompting concerns about the lack of specialist psychiatric hospitals in the northern region.
Somebody who had mental challenges from Savalogu all the way to Pantang raises a serious question. What it means is that the entire northern belt has no facility, and that is why this happened. Is that not the case? And Chairman, if that is so, we need to advocate. We need to advocate for some facilities to be established in the northern parts of this country. Yeah, Director, do you have any plans to establish facilities in the northern parts of this country so that assemblies don't have to bring patients all the way from Savalogu to Accra? And that is only one instance. Only God knows how many more people may have been cured if there were facilities in that part of the country.
Mental health is somehow mainstreamed. And so there are beds and there are departments in the hospital that also take care of mental health cases. Whether the teaching hospital, Bolga Hospital, Wa Hospital, they have them. But I know that's part of the Agenda 111. Mental health, one is supposed to be built in Tamale. A psychiatric hospital is supposed to be built in Tamale. I don't know. But we have made generally mainstream that both from community level, mental health officers, and we have some psychiatrists in our regional hospitals taking care of these cases.
Additionally, the committee expressed regrets over the numerous procurement breaches in the health sector. Despite the Auditor General's recommendations for rectifications, MP for South Dai, Roxanne Nelson Dafiamekwo, called for the application of penalties outlined in the Public Procurement Act to address these infractions.
Let me read Section 92A of the Procurement Act. It reads, "A person who contravenes a provision of this Act commits an offense, and where a penalty is not provided for the offense, that person is liable on summary conviction to a fine not exceeding 2,500 penalty units or a term of imprisonment and not exceeding 5 years, or to both the fine and the imprisonment." So for me, even the rectification doesn't resolve the issue. So you need to take this matter seriously. It appears that procurement breaches are simply being glossed over and being treated with kid gloves. It's a serious provision that should guide you. So, Chairman, even the auditors, in giving recommendations, they should have recourse to this provision.
The committee has resolved to take a harder stance against public institutions that consistently breach the Public Procurement Act. They have therefore referred the management of the National Blood Service to the Attorney General for prosecution for consistently breaching procurement laws. For Citi News, my name is Charles Osukumi, reporting from Parliament House.